Uh, Actually, that's my second time entering your building, but that last time I was in the senior steer committee for humanitarian. And so we see the new buildings. So congratulate you're moving during pandemic. It's still deliverable for your staff. It's a good location, good environment, and good deliverable service to the people, to the members. And of course, it's a new home for us to come to have a meeting with you. I wish you especially thanks my dear colleagues and brothers, Dr. Tadeusz, for hosting this first in-person executive annual meeting of the Quadripartite. I also wish to acknowledge the World Health Organization for leading and coordinating the work of Quadripartite secretaries this year at the global, regional, and country level. I'm very pleased with our joint collaboration actions outcomes. Our collective work in advancing the One Health approach on the global arena, such as COP27 in Egypt and COP15 in Montreal and Kunming, and also the third ministerial meeting on MR in Oman was fruitful. We have put the spotlight on the Quadripartite joint commitment, raising awareness, and advocate of for One Health with a unified voice around the world. I saw during past 3 years, especially even G20, G7. Now it's become more coherent and united voice. One Health is also high on the agenda of G7 and G20. I participate in all this important meeting on behalf of FL and also in intention to promote, advocate One Health approach always in my heart and in my mind. Highlighting the need for multiple stakeholder solutions to today's complex interconnected challenges with impact everywhere on everyone. As I always say, we are all the neighbors in this small planet called Earth. What affects one of us affects all of us. At FAO, in line with our mandate and in complementarity with the mandate of Quadripartite, we promote One Health for agri-food system transformation, for the global health security, and for contributing to health people, health animal, health plant, and health environment. And we do this by supporting implementation of the One Health Joint Plan of Action. Furthermore, as part of the FAO Strategy Framework 2022 to 31, our One Health program priority areas aims to enhance productivity and reduce risk from the biological threat, applying integrated pest and biosecurity management approaches in countries for more efficient, inclusive, resilient, and sustainable agri-food system in a challenging and changing climate and the environment. FAO is committed to support the mainstreaming of One Health by generating, exchanging, and enhancing knowledge and evidence, all of which are critical elements of FAO new science and innovation strategy recently endorsed by the members. That's our first ever in the history of FAO. We have a strategy on science and innovation, and also first the chief scientist at the senior level as a core member of the core leadership. So chief scientific economist is not only professional post, it's one of the core leaders. In this context, I wish to recognize the important scientific advice provided the One Health high-level expert panel and look forward to wider engagement and enhanced innovations. And FAO's chairs, the Quadripartite developed a guidance for the UN residential coordinators and the country teams to include the One Health in their national frameworks and support the implementation on the One Health Joint Plan of Action at the national level. And the One Health intelligence scooping study for better early warning of threat to global health is another prime example of excellent collaboration. You know, the Tadros and myself, we were the minister of the country. So we know the country, all the relevant ministers take the ownership and partnership so important. Otherwise, it's just the lecture from the UN. Yeah. I think, of course, the lecture is very important, but we need action. So I think I really congratulate my colleagues during past year to make this joint action plan, and we are going to endorse today. One Health is already contributed to more sustainable agrofood systems by increasing productivity and reducing resource use per unit of output through the improved animal and plant health, and by ensuring a stable food supply leading to increased food and nutrition security due to healthier livestock and crops. A lot of people talk about the livestock, but actually crop of the 80% of food, not only for human being and also for animal feed. So the plant health is fundamental. It's real fundamental. You can imagine how much we eat, how much we drink, how much we even animal eat. It's depends on the plant health. And that's something I think so many years it's not so much pay attention to enough, in my opinion. So now I'm glad that people realize that it's a fundamental. Better animal health means low risk of zoonotic disease and the great food safety across the value chain, reduce the burden of the foodborne disease and improve the food quality. FAO has long advocated for One Health, including by supporting the effective management of zoonotic disease and AMR across the agri-food system and by encouraging research and innovation. At FAO, we know that by applying the One Health approach for the transformation of a global agri-food system will ensure all the four betters. Now it's become the overarching guidance for the transformation of global agri-food systems. Better production, better nutrition, better environment, and better life, thereby ensuring that no one is left behind. To progress One Health to the next level, Quadripartite needs to work even more and better together, galvanizing great investment and target financing of the One Health strategy and plans. I always said we are working for vitamin A and vitamin B and C, but who is care about the vitamin M, vitamin money? It's essential. People forgot vitamin M is a fundamental also for other vitamins. So now that our joint plan of action is fully in motion, we need to focus our efforts at strengthening joint delivery at the country level. We just had a talk and intensely, and Tadros will, on behalf of us, make some new initiative, new suggestions to take action to push to get our members more on board collectively, coherently, and communicating better with our members on our joint offer as a quadripartite. Otherwise, individual ministers, they already have their own action plan, their own initiative at the country level. The value added for our quadripartite collaboration mechanism arrangement should be, put the relevant ministers work together at the country level. Otherwise, I think the Minister of Health, they can do their own things. Minister of Agriculture, they can. Minister of Environment, they can. Why need through the FAO, through the WHO, through the UNI? So that's the mechanism of value added for quadripartite collaboration. So please, all our colleagues, try to create a value added things for our members, not for our own. Yeah, our four partners and with others, UNDP or IAEA or others. It's another level. It's of course we have to, but more important, I always say we should get the members at the national level work together, and they will appreciate our collaboration. Let us continue to work together for health people, health plant, health animals, and health planet for our collective prosperity. Thank you. Thank you very much.
Thank you. Thank you, TG Donyu, and you're absolutely correct. And if the ministers don't get together at national level, then that is a major challenge and a major opportunity. Let's pass on to Dr. Inger Anderson, the Executive Director of the United Nations Environment Programme.
Thank you so much, and good morning to everyone. To you, Tedros, thank you so much for hosting us. And of course, to Dongju and Monique, it's an absolute delight to be here today. A year ago, we signed on the dotted line. It was actually 3 a.m. in Colombia when I signed with you, but that being the case, we signed on the dotted line for the Quadripartite. And it is a year in which we've seen a lot of movement and positive movement. To my right, you will tell me whether we are beyond the pandemic or not, but we've also at the same time seen a lot of geopolitical tension, and we've seen a lot of intensifying climate impacts. But we've seen some wins for the environment, and I just want to highlight a few. We, under the Chinese presidency, we signed and gavelled the Kunming-Montreal Global Biodiversity Framework, a framework that we now have to bring to life. It has a strong text that deals with biodiversity and health. At the UN General Assembly, member states adopted the resolution on the human right to a clean, safe, and sustainable environment, something that we also now need to bring to life. At COP27, we agreed that the egregious lack of action on climate change means that we must have a loss and damage fund that we now must bring to life. At the United Nations Environment Assembly, we agreed that we must now negotiate a treaty on plastic, a treaty text that we are now bringing to life. And at the same meeting, we agreed that yes, we have IPBES that deals with biodiversity science. Yes, we have IPCC that deals with climate science, but we do not have a similar scientific panel that deals with waste and pollution. We are now underway negotiating the establishment of what we call the triplet, because we have the other two already. So the Quadripartite has played its role in raising the environmental health on the global agenda. One Health has a key role to turn these wins in conference halls into reality on the ground and into the real world. And we're beginning to make some strides on this end, but I think you will see that all four of us are very keen to roll this out further. This year started with us at UNEP at least, to bring a spotlight on the AMR, the antimicrobial resistance, through the report that we termed Bracing for Superbugs, which I launched with Mia Motley on the sidelines of the 6 Global Leaders Group on antimicrobial resistance. And this report shows the importance of tackling AMR through One Health, and highlighted how environmental transmission is in fact a major concern. We've had a lot of interest following this report. We also have brought together our joint expertise and now the One Health Joint Plan of Action, which we really strongly endorse, and of course closely supported the work of the One Health high-level expert panel. The panel's definition of One Health is journeying out there, and bravo, because that is getting a lot of uptake, and that is now the operationalization of that construct will be key. So my deep gratitude to everyone here and beyond who've been working on this, to WHO for very ably chairing this year as a secretariat. We as UNEP, we look forward to take over the chair position. And as we so do, I have 3 asks. The first is that we have to lift One Health work even higher by connecting the dots with the broader issues. We have to ensure that the world more fully understands and acts on these overall drivers of health risks, including climate change, land use change, environmental degradation, that we sort of can knit this together. Let's take the example of pollution. The Intergovernmental Negotiating Committee on Plastic Pollution is underway, yes, and the science-based panel, the triplet, is underway, yes. And UNEP and WHO and others have been working on air pollution for a long time, yes, but we have to continue to strengthen the links between human, animal, and environmental ecosystem health by including and shedding more light on the issues such as burning, open burning of waste, endocrine disrupting chemicals, and underpinning equity or inequity issues. On the biodiversity and nature side, meanwhile, the Kunming Montreal Biodiversity Framework, as I mentioned, highlights that linkage between health and biodiversity and calls on countries to integrate the One Health approach into their national biodiversity work. The CBD, the Convention for Biological Diversity COP in Montreal, COP15, also asked the Global Environment Facility, which, as you know, is a funding mechanism, to ramp up technical and financial support to mainstream this issue. So there's a lot to be done in this regard. Right now, the UN is doing a stock taking on how we have delivered on the commitments we made in 2021 at the Food Systems Summit. And as a quadripartite, we should ask ourselves how One Health approaches support sustainable food systems and transitions that enhance nutrition and food security. So it is about connecting the dots. And there's more to be done on this front. My second ask is, let's draw on each other's strength at the national and the regional level. We now have the joint plan of action to scale up our efforts on One Health. And now, as we build the nuts and bolts of this machinery, it has to be about how to support country uptake. And we need a clear line of sight between what we do in all these meetings and what we actually deliver on the ground. We need to weigh in jointly on important considerations such as how do we prioritize? How do we deliver country work? How do we ensure that it is needs-based and demand-driven and not top-down served up? And how do we jointly mobilize resources? And how do we ensure that we don't overlap and therefore waste resources? And let's not forget that there are many lessons and good practices to draw from. The Nature for Health initiative, where we have the privilege of being the secretariat, serves the World Organization for Animal Health and WHO as consortium partners. And that's a good example of how we can be on the ground. And the AMR Multi-Partner Trust Fund is another such example. And my third ask is, let's recommit to an equal partnership, recognizing that each partner brings to the table a unique value and different characteristics. We have to recognize the comparative advantages. We are not competing. Can I say this again? We are not. We, each of us, bring something unique from the science, from the on the ground, and from our journey in the international system. And we bring perspective and a collective and distinct convening power. And it is that power of the convening that we do with our respective constituencies. If we do it smartly, we can actually, at the very top level, also make the whole greater than the sum of its parts. So friends, a year on, this is our chance to pause and reflect. And UNEP, as the incoming chair of the Secretariat, will do all that we can to serve and to take this forward in the spirit that we are receiving it from my neighbor to my left, with goodwill and with hard work and with an absolute determination to learn and to listen and to have an iterative process. Thank you very much.
Thanks very much, Dr. Edison, and certainly connecting the dots and drawing on each other's strengths so we can scale up together. And I think what I liked most about what you said is the difference between what we say versus what we do, the gap between the current rhetoric on One Health and the reality of delivering, and to that statement to reaffirm the equal partnership, but the collective and distinctive voices that we have to convene. So very powerful. Thank you very much. Dr. Tedros, I think over to you for your remarks.
I think I would be happy to speak after all my guests speak. So, Monique, shall I transfer it to you?
Okay, Monique, you have the floor.
Thank you.
We should have guessed that.
It doesn't matter. It doesn't
Tedros,
matter.
can you turn off your microphone?
And thank you, Tedros, for welcoming us for this first in-person meeting of the Quadripartite. Thank you for that. Dear Tedros, Inger, thank you. I do believe that we can be very proud 1 year or 18 months after the creation of this Quadripartite. We can be proud of the work done by our colleagues here, because today we have a joint plan of action. Very soon we'll have an implementation guide so that regions, countries, and stakeholders can turn this plan into actions. And I do think that is our ultimate goal. So therefore, thank you all for all the work done over the past year and months. In addition of this joint plan of action, we'll have also a joint communication and advocacy strategy, as well as a joint resource mobilization strategy. And thanks to this strategy, I do think that we will be able to accelerate the implementation of this One Health approach by increasing understanding of the One Health approach and how it could be applied by reaching wider stakeholders groups and communities and regulatory authorities, and by supporting countries to prepare solid investment cases and mobilize their domestic as well as international resources. But if a lot has been done, we have also to recognize that there is still a lot of work ahead of us, but that is exciting too. Let me highlight only a few issues. First, I do think that we need to strengthen the governance of our One Health approach and build the legal framework needed to ensure the structures and institutional arrangements to advance the One Health approach at all levels are in place, particularly at country level. I do know that for my neighbor that is very important, but is right, as well at regional levels, and that these levels, national and regional levels, have the adequate resource. Second, we need to ensure we have the capacity to implement. We have a joint plan of action, but we have to implement it, and our membership should do also. This requires multidisciplinary, competent, and skilled workforce. And that is the first action track of our joint plan of action. We have existing training programs, curricula, and academies that can be further harmonized and employed in coordinated manner, and that will be a point of our agenda today or tomorrow. The third point I would like to highlight is prevention of health threats at human, animal, environment interface. For that, we need to understand what are the drivers and the interface that increase the likelihood of spillover events for pandemics and how to reduce the risks. To help make the case for prevention, it is crucial to provide decision makers with sound impact assessment of health, environmental, economic, and social implications of policies, programs, and projects, including development projects, extractive industries, and others. We should also provide policymakers with economic analysis, including cost effectiveness and cost benefit analysis. We have to convince them that is an added value to implement the One Health approach. Finally, the issue of sustainability and scale of interventions that are needed to make tangible changes and achieve the goal of a world better able to deal with complex and multifaceted crises. This requires sustained attention to One Health in the face of competing, changing priorities. That is not just a fashion issue, because we know that on the agenda of our head of state, there is a lot of other issues, conflicts, wars, disaster, and so on. And of course, pandemic prevention is only one priority for them. For these reasons, today, we will issue this joint plan of action, urging countries and stakeholders to join
efforts to carry out 7 priorities to achieve healthier and safer world. And this call of action is particularly important at a time when negotiations are still underway to define the global framework for pandemic prevention, preparedness, and response through a potential international treaty, international agreement, or the famous WHO CA+. We must convince our membership and the INB members of the added value of our quadripartite collaboration. And we at the World Organization for Animal Health, we are pleased to continue being the focal point for the quadripartite to the INB process. Strengthening our collaboration is also important at a time when the World Bank has just launched a pandemic funds to help countries operationalizing the One Health approach. And thus, I hope that we, the 4 DGs, we can use any opportunity to jointly promote this call for action as a testimony of our fruitful collaboration. Thank you, Tedros, for the membership during the last year of our quadripartite. And I would like to ensure, Inger, that we'll be a good partner for the coming year. Thank you.
Thank you, Dr. Monique, and especially for your focus on the need for a skilled workforce and for those investment plans rather than just plans at national level. Let's go back then to Dr. Tedros.
I will start from the meeting that we had earlier today. The 4 of us and our deputies and ADGs also. First of all, appreciation from all of us. We can see the hard work. Many of the moving parts are now taking shape. As many of our colleagues said, starting from the definition, the theory of change, the joint plan of action, then the implementation guide, the joint communication and advocacy, you name it. So it's a huge work. So thank you so much on behalf of all my colleagues here. We don't take that for granted, and we're very glad that the progress is being made, and our appreciation and respect. And then in our discussion, first of all, we endorsed the plan of action, so we will sign. And then the second issue is we would like to meet on a regular basis, maybe more frequently than the one, but we know meetings like this takes a lot of hard work. So the second meeting we're proposing is not like this. It's a very light one to just meet to see how we're doing, and it could be arranged on the margins of the UN General Assembly, for instance, or on the margins of other meetings. And then the third is the quadripartite MOU needs to be improved. So we have agreed to do that, but we need to do it as soon as possible. That's what we have agreed. We should, significant. I think we have to capture all the things we need to improve, but at the same time, we need to do it as soon as possible. Then the fourth is on coordination. The coordination among us is getting better, but the most important coordination is coordination at country level. So how do we make sure that countries, ministries, sectors at the national level coordinate? And we will start from just sending them letters, but we will use other means also to make sure that there is coordination, alignment at country level. So these are some of the issues we discussed. Just wanted to share with you, and then I will go to my speech, my formal speech. My brother, don't you, and my sister Monique, and my sisters Monique and Inge, dear colleagues and friends, it's my pleasure to welcome you to the first ever Quadripartite Executive Annual Meeting. It's an honor to host you today. WHO, together with FAO and OIE was easier, are especially pleased to welcome UNEP. Yeah, but it's close to WHO actually. The WA.
Yeah, a lot of people saw them maybe affiliated to WHO.
We're affinity group. We're close together. And highlighting the integral role of environmental sector and cementing our commitment to work together at the human, animal, plant, environmental interface. WHO established the One Health initiative in 2021 to coordinate our work both within the organization and with external partners. Human health does not exist in vacuum, and nor can our efforts to protect and promote it. With this common understanding, WHO is committed to working with our partners to promote the One Health approach and support its adoption around the world. We're proud to chair the Quadripartite this year and to have worked with all of you to launch the One Health Joint Plan of Action to help countries address multidimensional health risks, strengthen health systems, and help to prevent future pandemics. At the very core of One Health is close collaboration, communication, and coordination. We established the One Health high-level expert panel to provide scientific advice to the Quadripartite. We welcome the establishment of the One Health group of friends made up of member states who are keen to advocate for more political commitment, including for better One Health governance and coordination. We also welcome the adoption of One Health as a guiding principle in the intergovernmental negotiating process for the pandemic accord. Going forward, it's important that we have a concrete plan in place that outlines how we implement One Health at all levels. The Quadripartite is currently leading the development of a guide to support countries to establish and further strengthen their One Health systems and capacities. I would like to acknowledge the integral role that regional colleagues from all four organizations have had in shaping this guide. To complement this collaborative work, the Quadripartite is organizing several regional stakeholder workshops to facilitate the implementation of the One Health Joint Plan of Action. Long-term investment, funding, and resources will be vital to its success. Although the Quadripartite has been engaged with various high-level events this past year, our work does not just stop there. It's important that we are continuously advocating for One Health. Let me leave you with three priorities going forward. First, to continue to advocate for One Health, to raise political awareness and commitment, and this is why we are launching today a call to action. Second, engage with and support relevant stakeholders for implementation in countries. Third, work to develop and sustain financial investment so that One Health policies can be fully realized. I thank you all for your continued partnership, collaboration, and support, and look forward to working with all of you for a healthier, safer, fairer, and more resilient world. Ragnar, back to you.
Thanks, Chief. thank you all for your interventions. What we're going to do now is just maybe put some a series of more precise questions to the four of you, and then end with a more general discussion on financing. And we're a little bit behind time, so I'm going to try and catch us up a little by not saying all the stuff that people kindly put in here for me to say, but just go straight to the first one. And I think each of the DGs mentioned this in their opening remarks, and that's around political engagement. So the first question here will go to Dr. Monique.